So welcome everybody. Again, this is Laurie Call with the Illinois Public Health Institute.
Hi, good afternoon. Anna Barnes, Program Manager with IPHI.
Antonio Lagos, Program Associate with IPHI.
All right. So our agenda today, we have two community presentations. We're going to hear from Livestream today, Sound Generations today, and Michigan State University Extension. And then we're going to try out the peer consultancy model that we talked to you about during our last call. For the peer consultancy model, I just want to let you know that we've used it several times in person, and it's been very effective. We tried it for the first time with cohort A, and we had some discussion, not as much as we would have liked. We know that it's a new process for some of you, and so we're hoping that you'll try to jump right in and be really active and participate. PIMA Council on Aging has graciously offered to pose some of their challenges and questions, and we'll be using that model to run through the peer consultancy model. So in the model, basically, they will present their challenge, what they're grappling with, and you will have an opportunity to ask any clarifying questions to make sure you understand the challenge or the problem that they've posed for you. And then everyone besides PIMA will chime in to give some feedback, some ideas, some brainstorm. You don't have to have the magic bullet answer. You don't have to have know everything. This is really about free-flowing ideas and to just share anything that comes to mind, share previous experiences, point to resources, anything you can think of. So we will give that a shot at the end of our session. So with that, I'm going to turn it over to Anna, and Anna's going to, oh, I'm sorry, I've got to have teams introduce themselves. Forgot about that. So we're going to do the team introductions, and then Anna's just going to review a few of the resources that we've been working on here and some of the homework that you have provided to us. So for the team introductions, if you would introduce your team as I call out your organization's name, and then let us know about what accomplishment your team is most proud of related to your project. So,
There we go.
That was me.
Hi there, this is Dawn Opal. I'm an assistant professor at Michigan State University, and I'm joined by Don Contreras from Michigan State University Extension. We're both on the call. And I would say that the accomplishment that we're most excited about is that we have built some really strong relationships with primary care providers up in the Upper Peninsula to start thinking about multi-sector data exchange and care coordination. So we'll talk a little bit more about that in our presentation in a little bit.
excellent. We're excited to hear that, and it's a great follow-up to our last webinar with Jamie and Mark, so thank you. How about PIMA Council on Aging?
Hi there. So it's Rebecca and Victor on the call. And I think for us,
we're a team that, while we've been at PCOA for varying amounts of time, we haven't necessarily all worked together on a project. And so sometimes that can take a little bit of time to kind of find your groove, so to speak. But I think that we really found it quickly. And I think that our ability to have direct line communication with our executive management team, as well as working with our own team separately on this project and our goals, has really allowed us to be ahead of our own internal schedule for where we thought we'd be with this project.
Excellent. That's really exciting. Any tips on how you got that direct line communication to your executive team?
Well, I'm one of them. So I think having a couple of us that are within this work group at the table for executive management team has allowed us to kind of put ourselves on the agenda and have that input about the project and where we want to go with this into our regular conversation, and really targeting, as we're tackling issues around that table, how does this fit into those? And we kind of did that strategically so that we wouldn't lose sight of that as we were moving forward. We wanted to make sure that we had that voice in various groups as we were working.
Great, thank you. Sound Generations?
Yes, this is Paige Dennison. Can you hear me okay?
I can, thank you.
Okay, super. Yeah, so we've got here in the room Megan Thompson, John Gleichman, both in the IT and the data, and Camille Carlson, who works in the health and wellness department as well in process improvement. And I think something we're feeling really good about is that we have our external data security contractors ready to come in starting February 15th. So excited about moving forward on that portion of Goal 2.
Wow, great, fantastic, thank you. Let's move back up and see if we can hear from Livestream now.
Okay, this is Jenny Hamilton, and I have Megan Velasquez with me here in my office, and then I know it looks like Paul and Vanessa are dialed in from their locations. So I would say our biggest accomplishment, Vanessa we brought on board when we started. She works with our State Division of Aging, and Paul is our data helper. And so we got permission, Vanessa got us access to some state information that will go back since we started using the inter-RAI assessment in summer of, I think, 2016. So she got permission to get some data that will go back that far so Paul can do his IT work and try and get us some information based off the historical part of that. So that was an accomplishment that we got permission to get that information.
Great. We know that that's not always an easy task, so thank you. And Area Agency on Aging and Disabilities of Southwest Washington, just introduce your team, please, and let us know what accomplishment you've had in the last month that your team's most proud of.
Good morning, this is Tom Waltz. With me are Julian Fan, he's our IT coordinator, and Whitney Oswald, our QI coordinator. Whitney, do you want to talk about our progress?
Sure. We've made a lot of headway, especially as we've also been working with our Alterum Grant Award to kind of develop a project. And we're still kind of gelling some details, but we have kind of come up with a structure of having a quality improvement advisory board involving members of our own staff as well as community partners like professors from WSU and possibly a hospital system called Legacy, and also ALSA, which is our Washington State agency on like long-term services. Essentially, they're the state. So we're going to have a advisory board that kind of meets on a regular basis to talk about data issues, and we hope that it will be fruitful, that they'll be able to provide us with some of that expertise and outside knowledge to help us continue shaping our data journey. But we've also kind of developed a project where we're going to start trying to pull data extracts from a select group of our data sets to kind of look at a specific target group that we've been focusing on. And we've also met with some members of Tableau to discuss with them if that might work for our agency or what kind of analytics software we might be able to use with those data extracts to kind of start looking at our internal data and an analysis and synthesis of that.
Great, great. Well, that's fantastic. And I know Anna will mention something about your a tool that you can use to document what you learn about Tableau. And then also wanted to just mention when you were talking about the data set that you're going to be looking at, you know, thinking about any lessons learned from that you'd be able to share. So just kind of looking ahead as I heard you share that. So great, thank you for everybody being on the line, and anybody else who has not introduced themselves that would like to?
Oh, hi. This is Lauren Sokowski from ACL. I'm joining to listen in. Thank you so much.
Great, great, fantastic.
All right. This is Beth from n4a.
All right, well, we'll just keep moving along then. So I'm going to turn it over to Anna. She's just going to review some of the past things that we've been working on and make sure you're aware of those.
Great. So I wanted to walk us through some of the materials that we've been working on, which you may have had a chance to look at. First, we compiled the Q&A from the full cohort webinar that we hosted last month. So that is posted in the online community and available for your perusal. We also compiled key takeaways from that webinar, and we encourage everyone to keep this going as a living document. You can go in here, and as you're learning from conversations, it sounds like a number of you, and especially in the other work group, have been having conversations with healthcare providers or payers, and as you come out of those conversations with notes, that'll help inform this key takeaways document in terms of what are some of the best practices around establishing these partnerships and determining the right data systems. And then next, I just wanted to point out that we really want you to keep going back to your work plan and think about those, revisiting those and adjusting the timelines where it makes sense. It's great to hear that some of you feel like you're a little bit ahead of the track in terms of your timeline, and others are, revisiting them and making adjustments. So please keep referring back to those. And we've really enjoyed doing the office hours. We've conducted those with most of the sites. I think we just have maybe 2 more sites. And they've been really helpful to talk about current barriers and challenges and identify particular TA that might be needed, especially around thinking about data system or vendor and where there might be some hiccups in that work. So, yeah, I think that's all we had that we wanted to show you at the moment. So, thank you.
Okay, great. Well, then I think we'll start the community presentations, and we have sound generations on tap to start. So we'll turn it over to you now.
This is us. So just real quickly here, we've been asked today to define the programs we receive reimbursement for, describe who implements those programs, and go over the specific data systems used for reporting, receiving, and those elements that we track, and then share about the customized reporting function and talk about tips and considerations and kind of general lessons learned. So that's what we're going to do real quick here today in our overview. So this is a slide that just looks a couple of snapshots from our enhanced wellness and our enhanced fitness programs on the front. Oops. And I'm going to go down here. There we go. All right. And this is who we are. We're a multi-service nonprofit located in King County, Washington. So the greater Seattle area. And we support people on their aging journey through community connections and accessible services listed here. I won't take the time to go through all that because we've talked about it before, but just to remind you of the kind of work we do. Let's see if that's, and oh, there we go. In the health and wellness department specifically, where we're working out of on this project, we offer a number of evidence-based programs, and they're listed there at the top of the slide. Some balance programs, chronic disease programs, as well as depression management and caregiver support. So while all of our Sound Generations services are available in our region, our Project Enhance programs, Enhanced Fitness and Enhanced Wellness, as well as our data management services, are offered nationally. So that includes, listed below, their Enhanced Wellness and the Wellware system, and Enhanced Fitness and the online data entry system. We also do evidence-based program data management, having developed a couple platforms for the Matter of Balance program and the Pearls program, and we contract to manage the National Falls Prevention Database for NCOA. Okay, here we go. Okay, great. Enhanced Fitness is currently the only evidence-based program for which we receive payer reimbursement. Enhanced Fitness is, whoops, got a little ahead there. Not sure how that happened. Okay, thank you. Enhanced Fitness is proven to protect against falls, increase physical function, increase socialization, while decreasing depression, healthcare costs, and hospitalizations. So that's attractive to payers as well as the affiliates that are implementing these programs. And here in Washington State, Kaiser Permanente Medicare Advantage Plan reimburses on a per participant monthly program, and then nationally, Enhanced Fitness is endorsed by the Silver and Fit Medicare Advantage Plan Supplemental Program, which is part of American Specialty Health. And those reimbursements come straight to the site per policyholder per session. We currently have 1,400 plus of these classes going on each week in almost 800 sites in 44 states in the District of Columbia, with 90,000 unduplicated participants to date in our database. We've got user-friendly and customizable data systems, as it says, with outcome and reporting, as well as attendance tracking. And that's really what we're going to dig into here. And I'm going to turn the controls over to Megan, and she's going to talk about our data systems.
Thank you, Paige. This is Megan Thompson, and I'm just going to sort of outline the types of data that we collect. This is kind of universal across the different data systems that Paige mentioned before. In general, we collect participant information, and that's demographics, and also it includes identifying information about participants, and that becomes important when we talk about the reimbursement process. We also collect attendance data, and that varies a bit by program, but in general, it's session level by participants, so we know exactly which days people attend the programs. That's also important for reimbursement process. And then we collect outcomes measures, and again, that too varies by intervention, but it's either functional fitness tests for enhanced fitness or validated survey questions for most of the other programs. So specifically talking about reporting for the reimbursement process, as Paige mentioned, we have two payers who reimburse for enhanced fitness. Both of those payers require participant identification data that we collect, and they match that to their policyholder data. And then they will reimburse for the number of sessions per month that each eligible participant attends. So the elements of our data collection system that we use are the participant identification and demographics and the attendance. And the process is a little bit different for the two payers. Kaiser Permanente of Washington, we do the matching based on a list that they supply to us each month, and then we return the monthly attendance data for those eligible participants. And for Silver and Fit, that's really handled by the sites, but they can generate a specific report out of the Enhanced Fitness data system, and then they use that to report and receive reimbursement directly. Other reporting that the systems provide is sort of general program management reports that the affiliates can use, and those include, these are sort of samples of those reports, aggregated outcomes reports, satisfaction surveys or evaluation surveys, demographic profiles, process management, like seeing who's due for fitness checks or other outcomes measures, contact lists, and that sort of thing. And then we also have participant-facing reports for enhanced fitness and enhanced wellness. And we'll take a look at those samples. But those give feedback to the participants about their progress in the program. So these are some samples out of our test database for enhanced fitness, PEARLS, and matter of balance outcomes reports that an affiliate might use to see how their programs are doing on aggregate. And then samples of the participant-facing reports for enhanced wellness. That's the current issue summary that participants see after they've completed a questionnaire and have that questionnaire scored. And then for enhanced fitness, the report shows their progress through the program, through their many months potentially in the program, and how their fitness test scores have changed through time. And so we have a few slides that kind of outline how we got to this point and thoughts and warnings about our progress. I'll sort of turn to Paige if she has anything to add, but in general, we've found that having a data system for these programs has been really important to the dissemination of the program. We originally were collecting data for research way back in the early days, and we just continued with that, but we found that shifting the focus from collecting it for research to using the data for providing information back to participants on their own progress was really important. Also providing data in a format that allowed the affiliates to use the data for their reporting purposes and showing return on investment. Their leadership was important, and it really helped to keep the sites more interested in collecting their data because they found they had a real use for it. The systems that we chose, Salesforce and SQL Server reporting services, we ended up using because, well, primarily because they were very low cost to us. We got them for free. Salesforce has a grant program for nonprofits that was very important to us. And then we have Microsoft products granted to us as well. So that was kind of key behind that choice, but they've ended up being really useful systems for us, and we like them very much. And then we were also very lucky to have our developer on board who's been with us from the outset. He's really understood data and how to use it and how to make sure that we could use it well. So that is also a bit of good luck. And we were also fortunate with respect to the reimbursement process. The data that we were already collecting is what we needed to use for the reimbursement. So we knew participant identity, and then we were already collecting pretty granular attendance data. So those two pieces we already were doing, and that's what we needed to do. That's great. So lessons learned and what's next. We have learned that having good data systems and good reporting has been very valuable in both engaging with our affiliates, also maintaining program fidelity. We're able to monitor that, and so our master trainers out in the field by using the data. And then leadership at affiliates are able to use the data for reporting that they need. We have also learned that as we've built the system out, we've done a lot of customization. So we don't have necessarily very standardized systems, and so that takes kind of a lot to maintain, and so that has been proving to be a little bit challenging now as we've gotten quite a bit bigger, and we do tend to try and provide what people need, so that can lead to a lot of one-off customizations. And so we're looking at upgrading that, kind of getting everything more standardized. That's quite a process. And we've spoken before about wanting to switch from one Salesforce platform to another, and that's also going to be a big project. So I think that's one of our goals, to plan for that. Yeah. Do we have more slides? Is that it?
I think the last one was just circling back to these are the goals of our participation in the Learning Collaborative. Relating to what we just shared about who we are. So that's kind of what we have for you, and happy to answer questions as we do time.
Great, thanks. I know we did have a couple questions come in from two folks. Anna?
Sure. So Don Contreras, do you want us to, well, I can ask the question for you, and then if do you do the billing for your classes yourself, or do you go through a billing service?
So the affiliates, the organizations that are delivering the Enhanced Fitness program or the Enhanced Wellness program are how they bill for that. You know, some of them charge, for instance, Enhanced Fitness is an ongoing program. They may charge a fee for that for folks that are not policy holders, but that's up to them from a sustainability standpoint. But for like Kaiser, for instance, we process that here. So there's a matchup of their policy holders that are eligible that attend the enhanced fitness program that we do, you know, in a secure way. John does the magic of the algorithm behind the secure systems. And then we know Kaiser pays us directly based on a contracted rate that we've negotiated. And then we, in turn, pay the affiliate sites. So we send them a check monthly. So we have a little bit of a processing fee that we keep, and then we turn around and send the rest to the sites for sustainability.
Great. And then she had a follow-up question here. I understand that the PEARLS is a home-based intervention. How do you blend the outcomes of that intervention with interventions that are conducted in groups, such as the Enhanced Fitness Program?
This is Megan. So each of the programs that we mentioned, we have a specific data entry platform for them. So the application is different depending on the program. And so what we collect for Enhanced Fitness is different than what we collect for PEARLS or for Enhanced Wellness or any of the other programs. It specifically uses the tools that those programs use in the way that they deliver the service.
Right. I just had a question about, you mentioned about being fortunate with Salesforce and the offering free or discounts to nonprofits. Did that include customization of Salesforce?
No, so we had the grant of a certain number of user licenses on the enterprise platform, which is the one that has all the features. So they gave us that, and then we're kind of left to our own devices. But we had folks on staff who were able to get up to speed with developing on the Salesforce platform pretty quickly. So we actually worked with a consultant for the first application that we built. And learned from that, and then we were able to kind of go off and do the other ones by ourselves.
Great, thank you. Okay, we'll move on to the next presentation, and Michigan State University Extension let us know that this has been a very busy time for them. They're hiring for a position right now, so they will be able to answer some questions in addition to what they're going to share if we need them to. So.
Okay, so I think this is Dawn Opal. I'm going to let Don Contreras start with a brief overview of the Michigan State University Extension Service, just to kind of give you some context for what we're doing.
That sounds great. Thank you, Dawn. This is Dawn Contreras, and I'm a specialist with MSU Extension under health programs. And as is the case with all extension services across the nation, we have programming in every county in the state of Michigan. And in particular, we have programming related to older adult health programming in the area of disease prevention and management. So our evidence-based programs are very similar to the ones that were just presented. A lot of the self-management education programs, particularly related to diabetes, chronic disease. We do falls prevention education, matter balance, as well as Tai Chi for arthritis and falls prevention, and as well as powerful tools for caregivers. And so we have a statewide cadre of educators across the state of Michigan who deliver these programs, as well as consistent instruments for evaluation and a database in which all of the evaluation data is entered into. And then program-based reports are established every year annually for stakeholders, as well as community-based program reports are established as needed. So that's kind of a very brief overview. And Dawn, I'll turn it back over to you for the specifics related to what we're thinking about doing with this particular project.
Great. So what we're here in the collaborative to talk about is to think primarily, I think we have a lot in common with the presentation you just saw, which is great, but we're a little bit in the earlier step. My research primarily focuses on care coordination and on the screening and referral process across primary care to evidence-based community programs. And so we're looking to find a technology solution that captures that screening and referral and closes that feedback loop. But Extension Service also has some needs for internal data management as well. So for that reason, we have that two-prong project summary. I basically just put our work plan up because we're very early in. I would say that right now we have been taking a lot of meetings to identify who our stakeholders are and to identify what IT sort of resources exist on our campus that are used by other programs. Our IT support was for a long time very fragmented. Each unit had a different sort of IT support, and we're trying to figure out the way, which other programs may have something that we might be able to use here with Extension Service. I have a research team that's conducting a landscape analysis of other types of systems that are used in similar programs for data management or multi-sector data management. And I'm happy to share that when that's completed with the all-in community that we're all a part of, and also with this collaborative. So stay tuned on that. I actually didn't have that on the work plan until May, but I think we'll have that much sooner. And then, we've been learning from you all, so thank you. And yes, the main grant that I, as an academic researcher, am working with Extension on has been hiring a project manager who will be really integral to these efforts. So for that reason, we're a little bit behind and learning from you all as we proceed. We have one thing that we have as a strength, and this is something that we can talk about in Q&A and I think relates to prior collaborative sessions, is we have built really strong relationships with both residency programs that are affiliated with Michigan State University College of Human Medicine, as well as family medicine clinics up in the Upper Peninsula of Michigan, several of whom are interested in piloting different kinds of screening and referral programs. And so the piece that you just heard about reimbursement and payments through Medicare Advantage, that's something that we're very much looking to kind of that last piece to put all of that together. But the great news is that we have partners at these clinics and at the College of Human Medicine that are interested in trying this with us, which I have always felt to be the hardest part to get the buy-in. And we have had some degree of success. So we envision that that starting by the summer, we'll have several pilots in place for screening and referrals to MSU Extension programs in primary health clinics. We've also been holding several meetings where, we're trying to figure out also what, if we're going to work with a vendor and different kinds of data management and data sharing opportunities that are available up in the Upper Peninsula. And so we can talk about this if I think there are several other teams here that are probably more advanced in this than we are, but looking at health information exchanges and what kinds of data are collected by one particularly called MyHIN, the Michigan Health Information Network. They gather some nationwide data and statewide data that might be useful for Extension Service. So we've been continuing to look at that. And like I said before, we're now kind of in the process of trying to figure out which tools we want to use to do the screening and referral process. I can talk to you more about that. I've piloted one in a primary care or in a senior health clinic. Actually, it was a senior health clinic that was a screening and referral tool for evidence-based programs in the community related to the social determinants of health. So we ran a 6-month pilot to see if we could get a workflow established to do that kind of screening and referral, and we're looking to do the same thing with Extension. So this has been a time where we're really just building relationships, and I think probably relates more to what we talked about in the last meeting in terms of how do we make those connections to be able to try to do this. So that's where we're at. I think that we've been exploring also reimbursement payment policies with payers, also looking at groups that are trying to expand Medicaid reimbursements for programs related to the social determinants of health, but definitely the Medicare Advantage also seems to be, I think, probably the place that we'll start. But I'm working with policymakers and health services researchers at the University of Michigan also to look for initiatives and actions to expand reimbursement opportunities with payers, including Medicaid. So that's kind of a policy dimension of this work that I'm doing as a researcher. So if you have questions about that, I'm happy to answer that. Also related to long-term care, we have the Michigan Choice Waiver. It's something that we're also looking at how evidence-based programs can support different kinds of long-term planning. So that is kind of also, we're working toward that and also learning from you. So so for that reason, I think we are a little bit earlier in that we still have not actually chosen the tool that we're working with, and we're really in the middle of conversations, but do see a really positive way forward. And I'm hopeful that by the time this collaborative is over, we'll have some significant achievements to share. So with that, we open it up for Q&A. I apologize that we didn't have more content on slides. I think, you know, in the relationship building process a little bit earlier in than the last project, but I think that makes it really helpful to see how you advance from here to there. So thank you so much.
I wanted to just say on that last presentation, I appreciated the candor. I think we all kind of are struggling with our own little demons in terms of finding our way through a maze of challenges and the ripple effects that seem to go along with new project design. So I just wanted to say I appreciated that, if I read that correctly anyway.
No, I think that's absolutely right. And, you know, the cultural dimension of this work, you know, that we're trying to get our IT departments on board, we're trying to get, you know, buy-in from lots of different people who haven't necessarily worked together to exchange data before. You know, I feel those tensions significantly. And so, you know, what I think I've learned in the last 2 years or so is that it's not so much about choosing a tool as it is to build a climate where everyone, you know, is ready to hold hands and jump in together. And that's not an easy thing to do when it has not been done that way for, you know, 30 years. So, and, you know, there are significant obstacles. And we've had, you know, I would say that the most value that we can contribute right now is that we've had hours and hours and hours of conversations with the payers, with UP Health Plan up in the UP, and with providers, and trying to find something that can better integrate these evidence-based programs into their practices and into their care management processes. And it's very hard because we have competing sets of values and competing workflows and timelines. And so those meetings, I mean, each one takes, I mean, we have 6 meetings before we get to a place where we sort of understand each other. And so, you know, if there's anything I can contribute to this conversation, it might not be so technical yet because we're just not there, but it is about kind of the perseverance of staying in and trying to navigate this myriad of, you know, kind of policies and routines and practices that don't necessarily align very well.
Yeah, Don, that's really valuable because that's a really critical step that can't be overlooked in building these relationships and understanding, you know, the other partner and what type of information they need or why they're coming to the table. So we appreciate that. Don, did you hear the question that I had asked, or did someone else ask a question before that?
I think I see here, is it the systems our team is exploring for the landscape analysis?
Yep.
Cool, okay. Yes, and so yes, HealthIPHI, Aunt Bertha, now POW. So we're looking at, I'm actually having my my graduate students look at the difference between all of the different, you know, sort of software versus cloud-based versus, you know, and so products and services. You know, looking at different kinds of what their proprietary schemes are in terms of licenses or per use or, you know, all of this, they're kind of creating a big chart for me so that I can kind of get a sense of what's out there and what people are using. NowPow actually has a white paper that kind of does this work too, and I found that to be really helpful. We are really focused on trying to find a screening tool for the social determinants of health that could directly auto populate referrals to different community-based organizations. I have a colleague who has built something to that degree that created a referral tool, but we don't yet have the integration with a program like those that I just mentioned, like NowPow. So we're trying to figure out, for those providers who don't know even really what to look for to know to refer, you know, can we automate that system in a way that's useful to them? And also, could there be potential EMR, EHR integration? So, you know, I think we're thinking really, and you can tell I'm an academic researcher because we're like, let's just think really big and think about like all the possibilities that might exist. And then, you know, for that reason, we're not maybe as pragmatic to be like, well, here's this tool and let's do this thing. And so that has maybe slowed us down a bit, I think, because we're trying to take a systematic look at these many tools that exist. But again, I'm very happy to share it with this group when we're done.
Yeah, a couple of thoughts on that. I mean, for sure, a tool like that would be useful for this group as well as for the broader all-in community. I mean, we get questions all the time about those products, and we've been talking about actually doing some sort of instead of like a vendor demo fair, having more of like a user fair where maybe once a month we'd have users of these different systems share what's worked and not worked. In particular, we know we've heard some positive things about like one of them and not so good things about another, and having it come from the users sharing that experience. NowPow, I know, is doing some HIE integration work in Trenton, but that's kind of their first dipping their toes into that. And I think some of them do have the functionality around auto-populating the referrals for the community-based org. So as you're putting that grid together, I'm sure it would be very useful for others as well. Thank you. Did anyone else have a question for Dawn, Opal, or Contreras? Okay, great. Well, thank you. These were great presentations, and they married very nicely as well, so we appreciate that. We're going to pivot now to do the peer consultancy model. So if you haven't asked a question yet, be ready to share some feedback for PIMA. Lori's going to give a quick overview again of how this works. And then we're going to turn it to Victor to outline the challenge and the brainstorm opportunity here.
Great, great. So the idea here is that there aren't any wrong answers. We're really doing some brainstorming and sharing, and we're not evaluating the answers or asking questions back. So it's more about providing potential solutions for the team that's presenting the challenge. So we're going to hear from Victor, as Anna said, describing the challenge or the questions. After he finishes describing that challenge and asking the questions, we'll have a minute or two for any of you to ask any clarifying questions to make sure that you understand the problem. Once we all have a good shared sense of understanding of what the problem is, what the question is that Victor's asking, then it's just a set time period of about 7 to 8 minutes, longer if we need it, for brainstorming ideas and solutions and responses to the question. And then we will wrap that up by hearing Victor summarize back what he heard us say. So we're going to try to give it a shot and see if we can do that. We have on the next slide some sort of timers that we'll use to try to help us keep on track. So I'll be alerting you when there's 30 seconds or 60 seconds left. But we're going to go ahead and turn it over to Victor right now to just give some background and describe the questions and challenge that he's posing.
Okay, so I'll take you quickly through basically where we are, where we think we'd like to be, and what our problem actually is that we're presenting. So where we are is that we've mapped our current systems. That means that we understand our physical workflows, from the first phone call that comes in to when we provide service. We understand what assessments we collect as far as things like everything from basic surveys to caregiver assessment to our case management when collecting ADLs, IADLs, that type of information on clients. And we understand what reports we can provide at this point. So output reports for the most part to our funders and government agencies. So our concern really is if we pick a data system now, it may not have the capacity to collect or add new data, or it's going to require an unanticipated cost, much like we saw from the presentation earlier. We'd like to do some imaginary mapping at this point to try to help us plan for data that we think we need to collect moving forward, and to consider how it may integrate with other systems, especially those used by managed care organizations or hospitals. But we're not sure how to do this. And some examples of where we're not sure where to go is that, one, although we collect assessment data and use it for authorizing ongoing services or changes to services, we don't otherwise run analysis on that data, especially across our population, what impact we're having. We don't know what additional data we should be collecting to be able to do that. We also don't know if we need to collect any of that data more often to have better analysis. And we don't know what managed care organizations especially are looking for as far as the impact we have on our community. What should we be measuring to present to those organizations? So at this point, we're not sure how to map the unknown, what other data we should be collecting that we aren't yet collecting, how we should be collecting it. Specifically, our goal is to be positioned to implement our desired future use cases, and it's 3 of them. One is partnering with healthcare and managed care organizations, planning and positioning ourselves for future growth, and then responding to our funders. So really what we're looking for, and we're starting to potentially work with a consultant that'll help us fine-tune our data collection. But we fear going forward, we are getting in a data decision paralysis or over planning. And what we're looking for, you all as a group who have experience in the types of work that we all do, AAAs, community-based organizations, and experience doing what we'd like to do, is some feedback as to what we should be looking for to help us plan going forward. And I'll clarify whatever anybody needs clarified.
Thank you, Victor. Any questions about the question, the big challenge that Victor's described?
This is Tom in Vancouver. I'm wondering, Victor, if you've had a chance to convene or bring together the various partners, funders, planners, and ask them how they might respond to these questions, or this question.
Good question. We haven't, for the most part, done that. Our current funders are basically government agencies and some others that look for outputs. We haven't been asked for a lot of actual outcome data from them. However, going forward, we want to partner and branch out, and because we haven't done a lot of that, that's where we're not sure what they tend to want. Did you want to add any of that, Rebecca?
I think there's a very small number of folks that we currently partner with for funding, and they're not large pools of money. that have requested some outcome data as opposed to outputs, and we've tailored the information that we're providing them specifically to what they're asking for, but they're very specific questions and data that they're requesting, so it's not necessarily something that would be widely applicable to our other programs. So I think at this point we're kind of being reactionary in that process and not necessarily stepping back and looking at it as how can we apply this to other things.
Great, thanks for the clarification, which also, that question might have been a potential solution, but it's also a question. So we'll start the brainstorming and consultant process now, where all of you besides Michigan State are responding and giving your best advice or guidance to them. I'm sorry, to PIMA. To PIMA, what's your best advice to PIMA on what other data should they be collecting that they aren't yet, and how should they be collecting it?
This is Whitney from Vancouver. In our experience, when we've talked with different partners, it seems like most of their concern is related to cost. So I think it might be helpful to figure out a way to tie your services to maybe like lowering admissions or lowering negative outcomes, or maybe, comparing it to something that they can use to show like a return on investment or cost driven. It's my understanding that that's what like healthcare and NCOs are most focused on. So something like that might be helpful to partner with them.
This is Anne. I do agree with Tom. I think talking to the people themselves and getting their input, I think some, in addition to costs, quality indicators can be really important to an institution in terms of outcomes, but and there are some standard ones that are collected, but I think the way you can best figure out what they need and how often is to actually talk to them.
And just along those lines of questions, if anybody has some ideas on questions that you ask those providers, or you have a guide of things that you have shared or discussed, or questions you've asked when you've met with them, particularly thinking about Michigan State right now, since you were talking about the hours and hours that you've been engaged in these types of conversations, that might be helpful to share too.
This is Dawn Opal from Michigan State. I'm happy to take a stab at that. I think that, like was just said, the important part is that when you start, you try to get a sense of where the particular practice or payer is situated, and what their current practices are, and try to identify what would not be a burden to them. So part of the thing that we've had to try to figure out is, it's not so much, it's more the labor, figuring out who is going to bear the burden of the labor to do the coordinated work, and how can we provide grant support, provide, how do we figure out how to make a workflow that could work for them, and what, that ROI. But I think even beyond the ROI, just understanding, like, most people that we've talked to really want to help us and work with us, but they want to also understand how they won't have to absorb more labor to do the thing that we want to do. So trying to get at that understanding of, how do we share this, or how can we in fact make this easier on them? What is a workflow that works for them? So I tend to, at least here where I'm situated in mid-Michigan, I'll go into the clinics and try to meet with the people who are doing billing, people who, where is the place where this burden would fall to do this work, their clinic or in their practice group or whatever, and try to figure out how we can support them so that they don't feel like they're just adding work to work with us.
Thanks for that. We still have a couple more minutes for ideas.
So this is Paige at Sound Generations. Can you hear me okay? Did I unmute?
Oh, we can hear you fine. Thank you.
Oh, can you? Okay. I'm never sure. Yeah, I think this is a great discussion, and I know right away when it started, you know, Megan looked over at me in the room and said, you got to have a really flexible system, and that's something we found really helpful within Salesforce. In having the conversations with the health payers and the providers, you know, it's been a real systems change for us as a social service organization to approach the payer or provider, or now they're approaching us, more with a solution mindset and asking them what their problems are, because everything we do addresses social determinants of health in this population. So they're going to differ depending what the needs are in their catchment areas a lot of times. So a good toehold for us in having some of the more recent conversations around Medicare Advantage plans, et cetera, as those have proliferated, have been around the quality measures. So looking at, you know, the 2018 ratings are out on, and you can look at those on the HEDIS measures, and you can look at the plans, and you can see where they're failing and where they're doing really well. And that's a good thing to think about as you're having these conversations. How can you help? And if the burden falls more on you as an organization, then that goes into the pricing for the service that you're providing. So there are some quality measure tools out there that I can put into the, you know, spreadsheets that lay out what the measures and data points are that I can, I'm sure I can get permission to share into the database that we all look at.
That would be great. Thank you. We're in our last 30 seconds. Any other ideas? We've got one from Paul from Live Streams, and Paul says, let's see here. Use cases for your data will also influence how you structure your data storage and accessing methods. For example, sharing live data to coordinate services will be structured differently than data stored for analysis. So with that, Victor, will you summarize for us what you heard and what let us know if this was helpful to you?
Sure. I'll start with, yes, this has been helpful to us. So thank you, everybody, for your input. So broadly speaking, which makes a lot of sense, is to talk to potential partners to see what they really need. And we're starting to do that, and we'd like to do a lot more of that. So it's good to hear that's definitely the right approach, and that you all have found that they're willing to talk to you, especially then getting to the other point where we can provide two things, is an ROI-based approach where there is return on investments for them, and reduction of, I think you also mentioned reduction of negative outcomes. So if we can help them not just save money, but reduce any negative outcomes, that's a good approach. So that gets us, I think, to where we wanted to look at, is how do we also prepare to talk to those people that we haven't been able to have those discussions. And that's where I think some of the other ideas that you all provided to come in, and we heard a little bit of this a couple webinars ago, I think, and that was in the main group where one person, you know, the presenter, I can't remember his name, said we have to talk the same language. So that's where I see you all telling us about who will bear the burden of labor, what return on investment, what negative outcomes we can reduce. So as we look forward, we can look at those potential partners and see where we can approach them in that direction. And then sound generations especially, and we saw this in one of your slides, to have this flexible system where we can put things in, pull things out as needed, and then Paul's last comment about the use case will sort of dictate how we store and use that data. So it's all been very helpful. Thank you.
Great, great. Thank you. And I want to thank everybody for being so participatory and sharing ideas. This really does only work if you're willing to take a risk and share some thoughts and ideas. So thank you for some great ideas. And also then going back, part of our Work in this Learning Collaborative is producing some shared documents and shared resources that we can continue to add to as we're developing them, and they can be tools and resources for people who come after you. So we're hoping to start another document or thread based on some really good questions that you've asked, or ways that you've started conversations with some of these healthcare providers or payers, et cetera. And Michigan State, you were mentioning that you probably have some of those. I'm wondering if you wouldn't mind just putting some ideas down to paper and sending that to us to get us started with a thread that people can add to.
Yes, I'm sorry, did you mean a list of questions with regard to talking to payers, or a list of the resources in terms of the technology? I missed that at the very end.
Yeah, actually, I guess we've asked you for two things. We do want to hear what some of those questions are, but earlier in the webinar, we talked about also hearing.
Yeah, the screening, definitely the screening tools, but then Lori was just now talking about like some of those tips you were sharing about how to go in and have the conversation, so that when PIMA is starting these conversations, they feel really prepared with like an agenda and questions. Yeah.
So we're just we're going to start a compilation of some good questions to ask. So if you want to kick us off with a couple ideas and spit those back to us by email, that would be great.
Sure, happy to do that.
Great, great. And then we'll post that thread for others to continue adding to. So I think once you see a few questions, it'll get your minds rolling to add to those questions, and then we will all just have a really nice set of questions that we can pick and choose from and tailor to whoever you might be having a relationship building meeting with. So I think that the peer consultant model worked rather well today, and I think it's because PIMA really spent some time explaining that challenge, and you were all willing to provide some great ideas. So thank you for that. I'm going to turn it over to Anna now to wrap us up in the closing, and just remind you that an evaluation does pop up automatically at the end of the session, and we really do want to hear your feedback so we can continue to improve and meet your needs as best as possible.
Great, thanks. So, I think we've already talked about this, but if anybody has anyone come across any new resources or tools that they want to just mention verbally now before we move on? So we do have some teams that have been posting resources on the online platform, so we appreciate that. Sound Generation posted a redacted business agreement. Livestream shared a data maturity assessment, and AADSW shared a QI toolkit, drivers of your data. I do want to point out that the discussion that we've been having around which measures, what data are providers and payers interested in, when we were doing the consultancy with PIMA. We have a thread already going in the online community for that around health outcomes. What health outcome data are you tracking? So Paige, when you're sharing the list of HEDIS measures and other folks, that would be a good place to share that information. So this, when you see the screenshot here of the group, you want to click to the far left tab forum, and we have 2 different discussion threads there. And Dawn, this might be a place to post, create a new discussion thread, which would be around social determinant screening and referral tools, as an example. And anyone is welcome to start a new discussion thread there. Next, we have our full cohort convening in March. We're going to do kind of a follow-up, deeper dive conversation, piggybacking off the conversation with Jamie Dirksen and Mark Henry that we had for the previous full cohort. This time we'll be hearing from Jason Smith with Aetna and one of his partners with the Council on Aging in Ohio. So those speakers are confirmed. We'll be sharing more information in the agenda with you forthcoming. And then in terms of the homework, if you haven't yet, so this is definitely homework for PIMA, is get those meetings scheduled and start talking to those, desired partners. Think about what you want to be asking them and what data they need from you so that you can build that partnership. Secondly, I want to point out this tool that we created. This actually started from something that Nikki Kaminsky from the Western New York Integrated Care Collaborative shared with us. So she had this very nice cheat sheet of vendors and products that they've been exploring, and we would like everyone to go into this document and add vendors or products that are not listed here. So going down, when you go down that first column, those are the products or vendors. There's a very short description of it, and then going across the top, the row across, are the attributes of the data system. If you are currently using this system, you can add a row below. So we can add a row under Thraces if you use Thraces, and you can fill out the attribute. You may have a different perspective on the attributes than Western New York, and that's fine. What we haven't done yet is start to populate the attribute definitions. Nikki said she doesn't have a cheat sheet for this, but I feel like it would be helpful, especially since this is about data and standardization, that we have a definition of when we think of this tool being user-friendly, what does that mean? What does that look like? If we say low cost, is that $100 per month? Is that $1,000 per month? What does that look like? So we hope that you guys can all go in here and update this grid, and as you continue to have meetings with vendors or software developers, that we capture that here.
Does this sound like a useful tool for you?
Yeah, this is Victor at PCOA. I think that's a really useful tool for us, and I've spoken to a few vendors, so I'll update any that aren't there, or if I've gotten different information from them.
Fantastic. So we want to make sure at least one person from your team completes the short webinar evaluation that pops up, and we will give you back about 9 minutes of your day. So thank you all for your participation.
Great. Thank you, everyone. Have a good afternoon.